respiratory distress syndrome and sepsis are devastating syndromes affecting critically ill patients who are receiving life support in our intensive care units. Both syndromes affect young and old alike and can result in severe organ injury like heart, lung, and kidney failure. And in the absence of life support, most patients would succumb to these syndromes. Despite adequate life support, the mortality remains high, and the quality of life for survivors is still poor. At this time, there are no specific treatments for either sepsis or acute respiratory distress syndrome. Researchers have come up with novel ventilation techniques as supportive strategies, but a cure for either syndrome does not exist. Stem cells derived from adult tissues have emerged as a strong possibility to treat critical illness, such as ARDS and sepsis.
Critical care researchers at St. Michael's Hospital are dedicated to identifying novel treatment strategies for patients with lung injury and severe sepsis, and for patients following severe trauma and resuscitation. For this reason, we have established the Critical Illness and Injury Research Centre, where we have clinical and basic scientists working together to develop novel approaches for these devastating illnesses. The spectrum of critical illness expertise available at St. Michael's and across Toronto is substantial and probably unmatched internationally. Stem cells have the potential to be beneficial for patients with acute critical illness because of three key biologic properties. While being immunologically inert, because they lack the receptor that would activate an immune reaction against the cells, they have anti-inflammatory properties. They are antibacterial, and they help to promote repair. Many promising studies where they have been tested in vitro and in vivo provide strong evidence that they may offer novel options for the treatment of these devastating syndromes.
Canada is at the forefront not only of critical care, but also stem cell research. We are in a strong position to really make a difference. We have the people, and we have the expertise, as well as the ability to translate this knowledge into better patient care. We are just about to start the world's first stem cell trial for patients with severe sepsis. We hope soon to also develop further trials to look at the utility of these cells for ARDS. Our US colleagues have already been doing this. Michael Mattei has already completed a phase 1 trial that shows the safety of this approach. We are also collaborating with other experts to develop a new generation of cells. Our goal is to find a cell-based therapy that will improve the survival and the quality of life of patients with ARDS and sepsis.
This is an exciting time for translational researchers working in critical care. There is much work to be done, but a real potential exists to change clinical outcomes of many of our patients with life-threatening diseases and the life-altering complications of ARDS and sepsis. The Critical Illness and Injury Research Centre will play a key role in finding therapies for our critically ill patients.